Serious, health professionals of Reddit, what are some of the most common things that freak people out about their bodies that is totally and completely normal? A small fraction of people, including myself, randomly get a sharp pain when breathing in, typically on the left side of the chest. It's really scary at first, but it only lasts for a few seconds to a few minutes at most, and episodes can happen daily, weekly, or monthly. It's called precordial catch syndrome and is completely harmless aside from the few seconds of pain. Link. Had a patient come in because she was concerned about bumps on her tongue. Did my history. Went to examine. Diagnosis. Taste buds. Their daughter's first period. Way more often than you would hope. We have mothers bring their young daughters in with complaints of abdominal pain and blood in urine. Didn't you go through the exact same thing yourself at one point? I have patients who develop a rash, look it up on WebMD, and come to me screaming that they must have Stevens-Johnson syndrome. Most common diagnosis. Contact dermatitis from laundry soap. Edit. Stevens-Johnson syndrome is very rare. But, if you do happen to develop a rash after taking new medication, see a doctor immediately. Infants, newborns especially, commonly have an irregular breathing pattern. We get a lot of ER visits from new parents who are convinced something is wrong with their baby. I would 110% rather tell parents your kid is just fine than the opposite. So I don't mind at all when parents bring their kids in to be seen. Recently had a diabetic patient complain that her blood sugar was dangerously low. Checked it once and it was 148. Checked it again because she was determined to convince me it was too low and she needed soda and a peanut butter and jelly sandwich. Level was the same. Good. Normal blood glucose parameters for a diabetic patient are 80-149. Dense breasts. I perform ultrasounds and a lot of my patients are referred to me from the mammo department. They usually come to my office nervous and frightened because they have been told they have dense breasts that require further imaging. I always have to calm them down and assure them that it is perfectly normal to have dense breasts. Dense just means there is less fat and more connective tissue in the breasts. Different tissues image better than others. And ultrasound is the modality of choice for dense breasts. But in the end, I'm glad that all breasts are carefully examined. BRCA is nothing to be conservative about. Edit. A few people have messaged me regarding my use of the acronym BRCA. I did not mean the actual B-Reest answer susceptibility gene. My office protocol uses that acronym when obtaining patient history, as in no prior HX of BRCA. I'm sorry if I confused anyone. Also, I'm really glad this has opened such a frank dialogue regarding breasts. I hope someone someway has learned something. Or will go to their DR with some great questions to ask. One of the most common worries of patients during my family practice rotation in med school. Having to poop soon after they ate. Woman came into the ER one time saying something was falling out of her vagina. Doctor did a pelvic exam. The whole deal. Turns out she was just so fat she hadn't seen her vagina in a long time. It was her labia. Earwax consults. I've said it once. I'll have to say it a million times. Earwax is not your enemy. It protects your ears. It has antibacterial and antifungal properties. And is absorbent. Not a week goes by without a consult for blood in the ear due to a Q-tip. Or a ruptured drum from puncturing it with a foreign object. Or a thermal injury from ear candling. It is not dirt. Not that one shouldn't be concerned about one's blood pressure. However, I'm always amazed at the number of asymptomatic people checking their blood pressures at 2:00 AM and then calling me worried because their systolic is 160. It can wait till the morning. Folks. Edit. My biggest wonder is why asymptomatic people are checking their blood pressures in the middle of the night. One of my first questions is always what made them think to do that at this time. Fishing for symptoms. I've never been given a good answer. Edit 2. Fixed a spelling issue. I work in lab. People freak out if there's a bruise. Somehow this bruise can only ever be my fault. Maybe I went through the vein. Maybe I used too large of a needle. Maybe I jammed it in too quickly. It's never your fault because you bled around my needle or were on blood thinners, and no amount of post-draw pressure could prevent the bruise. It's a bruise. It goes away. A male patient, same age as me, in late 20s, was admitted with a spinal injury and had to get a Foley catheter to relieve urinary retention. He was just so embarrassed and asked me if I see men's genital areas often. Answer is yes. All of male and female parts every day. Then he got an erection before the process, which is actually normal. But he turned bright red and couldn't talk to me for the rest of the night. Kids and fevers. People worry about febrile fever, seizures if the fever is too high, but it's not how high it gets. It's how fast it gets there. Please give your kid some Tylenol, acetaminophen, or Motrin, ibuprofen, before coming to the ER. We believe you that your kid has had a fever of 103 F, 39, 4C. I don't actually need to see it. Fevers can also last anywhere from 2-7 days, so rotating meds will help little ones feel better. Edit. I'm just a nurse, so here's some information. http health Cleveland Clinic org/2015/05/kids fevers, when to worry, when to relax on fevers so you can follow a doctor's advice. Sebaceous bumps. Your sebaceous glands can cause little bumps in certain places. Underarms is common. The one that freaks people out is sebaceous bumps around the genitals. It doesn't mean you have an STD. And most of the time they aren't really noticeable to the opposite sex. It isn't something to get too freaked out about. Getting more aches and pains as they age. So many people are on narcotics for minor issues. I know there are a lot of people out there that need them for chronic problems. But the amount of people who lay in bed complaining of pain 10/10 in their back astounds me. The best thing for getting rid of back pain, in most cases, is to get up and get moving. And I'm talking about the ones that have no signs or symptoms of discomfort. They can move. They don't guard or have facial grimacing. They just need those Percocet every 4 hours. And if you encourage getting out of bed, they look at you like you just kicked a puppy. Most people get aches and pains as they age. Some people just really don't handle it well. This isn't as exciting as the other comments. But it happens so often it's hard not to mention. I am always surprised when patients are very worried about minor constipation. If having a bowel movement once every 2-3 days is normal for you, that's okay. You are not unhealthy. There are some exceptions, especially in acute situations. But generally, if you aren't experiencing any discomfort, then there is no reason to stress. Well, there was that one guy who found a bump on his wrist and called the ambulance, me, to ask if I had an X-ray machine in the back to check what it was. It was a perfectly normal wrist. Patients often freak out and rush thinking they have testicular cancer because they noticed a bump on one of their testicles. In most cases it's just the epididymis and it's completely normal. Better safe than sorry though. Had a patient come into the emergency room complaining of vaginal odor. Doc does a pelvic exam and pulls out a garlic clove. He asked her why she put a garlic clove up her vagina. Apparently it's a home remedy for yeast infection. She had had it up there for a month or so and forgot about it. Oddly. Earwax. I'm a hearing instrument specialist, and when people see images of the inside of their ear they flip shitty seeing a tiny amount of earwax. Therapist here. Depression. I can't tell you how many people think a depressive disorder is the end of the world and that once they cross the magical line of being diagnosed they're going to be miserable forever because now it's official. There's nothing to be ashamed about. Depression is a lot of things, but it's never a flaw of character. I can't tell you how much time is spent in early sessions with a client where they want nothing more but for me to write them some kind of note to the psych saying he was having a bad day when you diagnosed. He's happy really. Double quote. A couple of years ago I had to get vaccinated for school. Afterward I keep feeling this wetness under the bandage. It's really weird. It wouldn't go away even an hour or so later. So I get slightly worried. Nothing like this had ever happened before and I've never heard about such a reaction. So it has to be something weird. Maybe the vaccine leaked out? So I go back and ask the nurses she can check it out. Here's where it gets embarrassing. After she carefully peels off the bandage, she informs me they used a non-alcohol based antiseptic that doesn't dry as quickly. Also, I'm a medical student. Bleeding while after pooping. Or otherwise blood from the anus. 90% of the time. Light red blood is a fissure or hemorrhoid and most people get them sometime in their life. ER nurse here. The stories I have. That being said, having a fever isn't bad. It's how your body handles the infection. So long as it's not an insane number. 106. Anyone? Comma and not there for ages. You'll probably live. Also, I'm weary to say this because heart attacks present in so many different ways. But, gas, and heartburn are totally normal things people have. It doesn't always mean the end of the world. But, still get checked out. Just believe us. Everyone gets so embarrassed over peeing and pooping. I get it. Been with someone for nearly 5 years and I still don't want him to see me in the bathroom. But really, we're not annoyed or embarrassed by helping you with those things. Lots of people tend to get nervous when they can't eat for several days during an acute illness. Everything I eat I vomit. Stop eating. You can survive for a long time without food. Let your body heal itself and then introduce bland basic food slowly. When you vomit you are throwing off your pH balance and losing water. So if you keep vomiting when you eat, stop eating. The most important thing to do is keep drinking. Sip small amounts of water continuously. If you can't keep liquid down then you need to go to the emergency room and ASAP, but don't worry about food. Had a young man come to the ED saying he noticed his heart beating really fast for the last 3 days. I asked if he had changed anything in his diet or was taking any supplements. Yes. Actually I started taking this pre-workout supplement 3 days ago. A quick Google search showed me that this stuff was giving him about 500 milligrams of caffeine in each serving. Lesson 1. If something new is bothering you, think about what changed right before your problem started. Lesson 2. Read ingredients. Lesson 3. 500 milligrams of caffeine is way too much. Allergies to meds. I can't count the number of points I've asked, are there any medications you're allergic to? And they can't answer it. They either don't know the difference between an allergy and a side effect, or don't know the name of the medication they're allergic to, and don't bother to wear a medical alert bracelet or anything. It's almost like they don't care. Pain response to surgery. It doesn't matter how well you prepare some patients. They will always act shocked that they need analgesics, pain meds, after their procedure. Everyone wants to act tough. I'm looking at you men age 25-55, but having your chest cracked open is no picnic and chest tubes hurt like hell. It's normal and you're not pathetic for crying. I had a female patient who was convinced that daily discharge from her vagina wasn't normal. To be specific, it was colorless and odorless, which is normal for the vagina to discharge every day. I even had a female PA come and explain that this was normal. I even showed it to her in a book. Googled it for her. Still didn't believe me. I have a bump on my chest and it must be a tumor question. Happened to several patients who lost a lot of weight. I congratulate them on their weight loss, then show them a diagram of the painless lump that they haven't seen since they have been overweight. It's there, xiphoid process, http. Health hall. Com xiphoid process. Not the nicest of topics. Women worry about pooing while giving birth to the point they are afraid to push in labor. It doesn't happen to everyone, and even if it does, it's normal and the midwife doctor doesn't care at all. If anything, it can be an indicator that things are progressing. I had a patient who put on blood pressure medication. When I checked his blood pressure it was 124/78. He started freaking out that it was not right. That it's usually over 140. I then proceeded to explain to him that's why we put him on blood pressure medication and how it works. Nearly everybody that fills out a form before speaking to me thinks Hebrews is easier than others. Which could be a sign for different diseases but nearly never is. A lot of 45-year-old patients come in concerned that they are having trouble reading, not realizing that everyone needs reading glasses eventually. That usually makes them feel old. Digging around in your belly button causing the tingling in your naughty bits. This is due to persistent nerve connections from when you had a urethus, the tube that emptied your bladder into the umbilical cord as a fetus. Regular heartbeat isn't. Speeding up when breathing in and slowing down when breathing out is utterly normal. Palpitations aren't anything unusual or bad. Sometimes it's just easier to consciously feel the heart at work. Usually at night. Then people freak themselves out over it. Which makes it worse. Not a heart attack. Extrasystoles are also pretty common, and while there are illnesses that produce more of them, totally healthy people have them from time to time too. It feels like the heart is skipping half a beat, followed by an extra strong thump. I always hear people complain about getting a flu shot, saying I don't get the flu shot anymore because every time I get it I end up getting sick right afterwards anyway. And I must explain, yet again, that the vaccination they receive is a dead or severely depletex version of the virus. And the sick feeling they get is their body recognizing and reacting to it, developing antibodies and inflammatory proteins in order to better react to the virus in the future. It feels just like being sick. Because that's what happens when you get sick. But you're not sick. Your body is just reacting as it should to the attenuated virus. TLDR, flu shots don't make you sick. The xiphoid process turns into bone as we get older. Many people come in worried about a new mass inferior to their sternum. But it is completely normal. Subconjunctival hemorrhage. It is where a small amount of blood gets under the external layer of the eyeball. A little bit can go a long way, in that it can turn the entire eyeball red. It looks serious but is harmless. It is usually caused by mild trauma or a ruptured capillary from coughing, sneezing or straining at stool. Lipomas. Common. Harmless and show up almost anywhere as small lumps. The most common place I see them is on backs and in the inguinal region. They are just a group of fat cells. Atypical lipomas can turn into liposarcomas, but this is extremely rare. Blood in the stool or when you wipe. Patients think they are internally bleeding. 95% of the time is just harmless hemorrhoids. The flu. Please don't call 911 for the flu unless it's absolutely necessary. Most of the time there's nothing that can be done to help you and you're putting everyone in the ER at risk. Call your doctor and see if they even want to make an appointment with you. Most of the time they don't, because you'll put their patients at risk as well. 99% of the time the best thing to do is rest and hydrate. Some men have veins in the left side of their scrotum that are enlarged. It is called a varicocele and though can be problematic if large, it is almost always no issue at all. Really freaks some teen boys out. Hemorrhoids. There will come a time in your early 20s when you will just poop a little too hard and tear a lining. And the next couple of poops from there will be bloody. They heal. But never fully. Every once in a while you just get another round of bloody poops. Almost like a male version of a period. Myoclonic jerks. That sudden muscle spasm. Especially when you are falling asleep and suddenly your whole body jerks. Absolutely normal as part of your brain realizes you are about to fall asleep and wakes you up. It's funny how many people come to their GP, my job consister in subbing for GPs, complaining of some mysterious painless strep throat. And that funny white spot is actually a tonsil stone. Elderly people really like to poop. So if they haven't gone in 6 hours they want me to order every laxative and an enema just in case. Blepharospasm or eye twitch. It's usually due to caffeine, stress, fatigue, etc. Very rarely indicates something more complicated, but I had patients wondering if they are having a stroke. I see a lot of people who have muscle twitches and immediately assume they're going to die of ALS. 99.5% of muscle twitching is completely benign. We've literally all experienced it. Especially in your eyelid when you're tired, sleep deprived, are stressed. If it's happening very frequently and you have weakness, get checked out. But otherwise, try not to focus on it and it will resolve. All the things that happen right after having a baby. Yes, you will be bleeding for, on average, a week, with some spotting for up to 6 weeks. No, the cramping doesn't stop when the baby comes out. Your gigantic uterus, dubbed a baby bag by a patient, needs to work its way back to being the size of a fist. Babies cry. They also poop. And the first few are thick tar that you have to scrap off their ass. It needs to happen. Just get in there and do it. You will not go back to your pre-baby body by the time you are discharged. Bring sweet pants and flip-flops. Especially cause you're gonna be puffy from the fluids. Breastfeeding doesn't magically happen. You gotta do work. Also, it hurts at first, but that goes away. Had a patient come in to be checked for the plague because he was running a fever. Bit didn't treat it with anything and was now fine. The concern was that they lived in the mountains and around squirrels. Astigmatism. I have patients coming in telling me in the same revered, hushed tones that they'd say cancer that the reason they can't see well is because they have a bad stigmatism. Stigma. My spiel. Astigmatism is a technical word that describes how your eye focuses light. You can replace words like nearsighted, farsighted, and astigmatism with just out of focus. It's not a disease. A camera, a telescope, and an eye can have an astigmatism. I work in an emergency department at a children's hospital, and in my experience, people tend to freak out more when it's their kids with medical problems, but there are a few that always make us laugh. It's hilarious when parents bring their kid in and the chief complaint is blood in the stool. We all know by now to look at their fingers when parents bring them in for this reason. If their fingers are bright red, we know we have another FHS or flaming hot Cheetos syndrome lol. Post-operation pain. Of course breathing deep is going to hurt. Those doctors are not very gentle when they're in surgery. YouTube any orthopedic surgery. One surgeon told me it's like human carpentry. I did have a guy cough hard enough his guts fell out. He was all like, I think I hurt something. I check under his covers and sure as shit there is blood everywhere. Funny how high dose painkillers really change a mood. Audiology student here. People think that if they have wax in their ears that they are unhygienic. You are not freaking unhygienic. Wax is good. It stops dust. And even better, bugs from getting to your eardrum. And when you use Q-tips you push it back onto your eardrum and make it harder to remove. Earwax will come out itself if you don't use Q-tips. With some exceptions, mostly people who use hearing aids, the rule is nothing smaller than your elbow should be in your ear.